Whereas a tooth whitening and a tooth whitening treatment, if it is just the colour of the teeth that a patient isn't happy with, is something that you can maintain at home at next to no extra cost. You have a course of tooth whitening, that changes the colour, and then it might be that you do that 2-3 times a year after that, okay? But you don't have to go through that full course of whitening treatment again. Okay, so composite bonding essentially could potentially change the shape, size, and in some instances the colour of the teeth. So most patients that come to see me that want composite bonding, or certainly think they want composite bonding, they'll usually come with some sort of element of the teeth that they're not happy with. It might be that there's an asymmetry. It might be that they feel the teeth are a bit gappy. It might be that they feel that the teeth are a bit crowded and overlapped. But there's always something, there's always some element of the tooth that they're not happy with. Now, what I would always advise is, if first of all, if a patient is unhappy with the colour of the teeth, start with a whitening treatment. And the reason being is that composite bonding is something that is a commitment. It is something that is added to the teeth that is always going to need replacing at some point in future. Whereas a tooth whitening and a tooth whitening treatment, if it is just the colour of the teeth that a patient isn't happy with, is something that you can maintain at home at next to no extra cost. You have a course of tooth whitening, that changes the colour, and then it might be that you do that 2-3 times a year after that. Okay, but you don't have to go through that full course of whitening treatment again. Whereas a composite bonding, you would have to have it redone at some point in time, again, depending on how well you're looking after it in the meantime. But if it's something that a patient comes to me with chipped teeth, whether that's from grinding the teeth, whether it's from an accident or a fall, sometimes some patients come in with gappy teeth. They feel like they have quite small teeth, quite narrow teeth. Then essentially composite bonding, how it works is we're adding filler material, tooth coloured filler material, to the outside of the tooth. Okay, that might be, if there's gaps, it might be to the edge of the teeth. If there's a little slight element of crowding, we might be adding it to the front to make that a tooth, camouflage it, make it appear a little bit straighter. It might be to the edges. If some patients have got a little chips on the edges, a lot of patients don't like a fangy appearance to their canine teeth. So sometimes you can add little corners to them to soften the spikiness of the canine teeth and just soften that a little bit. And essentially they're glued on, much like a very fancy but a false nail, if you will, or you know, on a set of acrylic nails. It's glued on, and in much of the same way as an acrylic nail is put on, the underlying nail and therefore the underlying tooth is untouched. So worst case scenario, if you know we ever end up in a situation where social media takes another turn, as it's now done with the spiky eyebrows currently, and rather than the sort of slimline eyebrows that the girls are getting, if it then goes back, we can always polish the bonding off. You know, if patients with gappy teeth previously, we fill up the little gap. Again, Madonna's the most famous one. She got rid of the gap, she put it back in because she missed it, and people told her, oh, it's kind of, you don't look like you anymore. If patients go away and have bonding on the teeth and they go away, have a look at it and think, oh, actually, I kind of want that, you know, that gap back in my smile. Or my family have said, I can't believe you've got rid of the gap, and they have second thoughts. We can polish it back off. And that's the beauty of Islam.